Welcome everyone to the 2021 Virtual Compassion in Action Healthcare Conference. I'm Angelina McCoy, Member Experience Manager here at the Schwartz Center. Thank you for joining us for today's panel discussion, Caregivers Center Reimagined, Grief and Bereavement for a Community in Crisis. Please join in welcoming our presenters. Marian Tehan is a licensed clinical social worker at Overlook Medical Center and will serve as our moderator today. Joining Marian are our panelists, Reverend Sharon Berniston is a palliative care chaplain at Overlook Medical Center, and Valerie Gagliano is a caregiver liaison for the Thomas Glasser Caregivers Center at Overlook Medical Center. Marian, Reverend Sharon, and Valerie, we're so happy you're here with us today, and I'll pass it over to you, Marian.
So actually, you're passing it over to Sharon. So I'm the palliative care chaplain here at Overlook Medical Center, and so grateful to be here with you all and share our experience over the last year and a half. We work here at Overlook Medical Center, which is a 500-bed acute care hospital that's in the suburbs of New York City. We're in New Jersey. And we were one of the hospitals that really got hit very, very hard at that first wave of COVID. Everything was overwhelming. We were all taken by surprise. And our Caregivers Center really turned things around and constantly shifted throughout this last year and a half. And we really want to share the ways they not only supported the families, but also supported the staff. But one of the ways we want to introduce you to our hospital and introduce you to our Caregiver Center is by showing you a clip that we used for our virtual memorial service. We're going to show you the beginning of it so that you can see where we are and a little bit about who we are.
All of us at Overlook Medical Center want to extend our heartfelt sympathy for your loss.
Todos nosotros en el Hospital Overlook queremos extender nuestras más sinceras condolencias por haber perdido a sus seres queridos.
Nous tous à l'hôpital Overlook voulons offrir nos sympathies sincères pour votre perte.
Ang buong samahan ng Overlook Medical Center ay taos-pusong nakikiramay sa inyong pagdadalamhati bilang mga pamilya at kaibigan ng mga pumanaw.
Todos nós aqui no Hospital Overlook Medical Center queremos dizer que foi privilégio cuidar dos seus queridos.
For those whose family and friends were served here, We want you to know it was a privilege to care for your loved ones. Journeying with them through this sacred time is an honor we will carry with us forever.
Queremos que tanto los amigos
So that was the opening of our video, and it hits me every time when I go back and think about doing that. And you could see our hospital, and you could see a little bit of our caregiver center. But Marion, you're the main force behind the caregiver center and have always been. So maybe let's start off by having you explain what the caregiver center was like pre-COVID.
Yeah, it's nice to think back pre-COVID. So actually the Caregivers Center, we're celebrating our 10th anniversary this month. And I've been here since the beginning and really have just grown this program. And the hospital created this beautiful space. And we've just evolved over the 10 years. Really, our mission is really to serve the families that have someone here, you know, in crisis in our neuroscience unit. But we've grown and really serve the outpatient and our community.
Yeah, and we have a lot of very, very sick people. We have a helicopter pad, so we get a lot of people from all over the state. And so people from local and from far away.
Yeah, and this becomes their home away from home. We have private rooms, we have massage rooms, and a kitchen. But what really makes it special, I think, you know, Valerie and our volunteers, and just how we can really provide a safe, like a refuge.
Yeah. Well, and you say private rooms, they don't stay here. You know, you actually often connect them with hotels and things like that. And Val, you're really here in off hours. I mean, you're right at the front lines here.
Yeah, so what makes our Caregiver Center unique, because there are a few in the country, is that we have continual care. So I work nights and weekends. So I work every weekend. And it's really helpful for the families. And also I speak Spanish, so I'm bilingual. So it helps a lot, helping families understand the healthcare system or helping them ask that staff, that unit for assistance on something they don't understand. And give them showers. The families here, we get a place they can have showers. So we try to do everything for the families here. Another thing, I coordinate, you know, we have art therapy, music therapy, expressive writing for caregivers. We have massage therapists come in, give them massages, because they're so stressed and we want to provide that comfort. So we have grants that fund that. So while they're here for weeks, they have something to do with their time to heal.
That's wonderful. That's wonderful. Another thing I know you do is you help coordinate our Bereavement Consortium. And Marion, maybe you can describe this sort of unique program that you and I created together about 7 years ago.
Yes, 7 years ago, Mary Pat Sullivan, our CNO, who's so supportive, you know, of the center and all our endeavors here, really reached out and said, I think a community member had someone die here at the hospital and just felt kind of a disconnect. And so Mary Pat put a group of people together and we sat in this room right here and like really just thought what we can do to improve. And out of this grew this Bereavement Consortium.
Yeah, I know some hospitals have bereavement counselors and full bereavement programs, but we didn't have that here. So what we did is we kind of found people that were doing things in little pieces, little pockets all over the hospital. And we kind of said, let's come together and support each other. And
really, it's been amazing. I mean, our initiative, one of our first was our bereavement cards. And this are team members here from all through Atlantic Health Systems pictures. And we had a contest. But really, because we found here in the center, the connection with families when someone died, we sent them a card. We called. Palliative care did the same. Hospice does the same.
So we put these cards together.
Right. And so now we have champions on the floors. Like we have on 3AB, we have Flo, and she sends the cards out. And then we have another nurse now who's championing on another floor. It means so much to the families to hear from Overlook.
Yeah.
From their caregivers here who took care of them.
Yeah, that's amazing.
And also the Bereavement Consortium, we educate. So it was to support everyone who's grieving, staff as well.
Yeah, and one of the things we did is we made sure, and we made it that at least once a year, we would have some kind of education that the community could be part of, staff could be part of, and just put things together one at a time. We
Yeah.
also have a memorial service that we do once a year.
Every November, we
Mhm.
work with oncology, our cancer program, our hospice and palliative care. And those are just beautiful ceremonies, very meaningful.
So you have this well-oiled machine of this great place, the Caregivers Center, and everything's going great. It's just wonderful. And then COVID hits. And maybe now we can show another clip from our video. Come on. Well, while we're working on this,
Yes.
yeah,
so
while we're working on
early.
it, let's talk
Yes.
about COVID hit.
So, yeah, it felt like, it felt like, so it was happening in New York City. And all of a sudden, we had like 1 COVID, 2, 3, and all of a sudden, to me, and Val, it felt like the whole hospital was now filled with COVID patients.
Right.
Visitation stopped. All of a sudden, our family caregiver center, where we had families coming in every day, volunteers, palliative care, child life, really working together, it just stopped. It just stopped. There were stop signs outside the hospital.
Right. And so now your mission to support the caregivers, now what are you supposed to do?
Yeah.
And I think it was also a very scary time because nobody really understood how it was being passed. Nobody understood anything. And frankly, if I were you, I might have like put my head under the desk and, hidden, but you didn't. I mean, you really didn't. Instead, you looked around and said, what's the need?
What can we do?
Yeah.
And what we really felt would really be helpful was, because we thought about having the team members, our staff, using the Caregivers Center as their refuge, right? But we're still having family members coming in for end-of-life discussions, for visits. There were compassionate visits all during COVID. So they did need a place to start off. So we couldn't do that, but we took all the elements of our Caregivers Center and we brought them to the units. And that was really with our patient experience team.
So Val, talk about a little bit, what did you do? What did you put in place for the staff?
So we try to give them like a little satellite of us and bring it to them. So we took the break rooms on all the floors and we converted them into serenity spaces. So there's serenity rooms. We put like radios, like boom boxes, and so they could put the CDs in of like tranquil sounds. We had journals they can write in, so they can make notes of how their emotions were, how they were feeling that day, and then another team member would write in afterwards. We had little fountains, yes, for like just the sounds, and we had live organs, bottles of water, and like Marion loves chocolates. We all do, but yes.
And we refill that in our patient experience team. The liaisons would go to those and replenish the chocolates and the water. Everyone wanted to do something, our community, the outpouring, right, of the food, but they didn't even have time sometimes to eat. So we just offered that space. We created that space.
Oh, yeah, well, and then, so you got that and you're like, okay. Well, you've also told me that you arranged a lot of community members wanting to do something. So they wanted to bring in food. So you kind of made sure that those could go to the right places.
To the right places. And then the really big thing was the families wanted to do something as well. So then they would, to a specific unit, maybe order food. And things like that. Just trying to connect caregivers, to us.
So now you had that going. Now you're feeling good. And one more time, you had a big shift. Tell us about that.
What was the shift?
Well, when Mary Pat.
Oh, yes, sorry, big shift. So what happened was, there were a lot of deaths were occurring. And in the news, they were talking about, the trailers in New York City. Well, here, right at Overlook, unfortunately, our morgue was overflowing as well. And now you have the refrigerated truck and the tent outside. So Mary Pat Sullivan again came and we sat down in our center and what could we do? We really needed to reach out to these families. So right away, we decided that the Caregivers Center, because of our experience with grief and bereavement, were the perfect fit for this.
So, okay, we're gonna take a break now and talk about this season by showing a short clip.
For everything there is a season and a time for every matter under heaven.
A time to be born and a time to die. A time to plant and a time to pluck up what is planted.
A time to kill and a time to heal.
A time to break down and a time to build up.
A time to weep and a time to laugh. A time to mourn and a time to dance.
A time to throw away stones and a time to gather stones together.
A time to embrace and a time to refrain from embracing.
A time to seek and a time to lose.
A time to keep and a time to throw away.
A time to tear and a time to sew.
A time to keep silence and a time to speak.
A time to love and a time to hate.
A time for war and a time for peace.
And this was a season. This was quite the season. And each season had a season within it.
Yes.
So you started with the staff, then you realized you needed to reach out to these family members, and you guys basically just got on the phone and you called every single family member.
And we did that within 24 hours.
Wow.
So we made those phone calls. But I think right away when that happened, because we had that bereavement consortium we spoke about, I had this group. And I don't remember like if we did it on phone or Zoom at the time, but we just got together and we just shared ideas. Like, what should we do here? Because it wasn't just a phone call.
No.
We know we needed to do more. Yes, we needed to help families maybe plan the funeral, but we knew there was so much more work to be done. And with that group, we're really able now, to get best practices. And Sharon, with your palliative care, you had this whole kind of program, and we took it. And we took the letters, we modified the letters, and we adapted that. So, we had the phone calls and the cards, and then Val will talk about that whole program.
Yeah. And let's go back. I want to go back just to the phone call. So your first phone call, Val.
Yeah.
How did you feel about that?
It was scary. Everything around me was just panic. And when I found out we had to make those calls, we were so happy to do them. But I didn't know they were going to receive the phone call. And I was a little nervous, but I had training with Dr. Alan Wilfelt in Arizona and the Center for Loss in Colorado. So Mary, had set up where I can go for some bereavement training.
So you had that prior to all.
And then working with you guys, I'm joining a bereavement consortium and getting all the education that was provided to staff helped me grow as well. So it's just different because I'm used to connecting with people in person in the center. And now I have to call someone who I don't know, who I'm a stranger to, on the phone. And what is the power of my voice? How is it going to be interpreted to them? So as I dial that number, it was the checklist that you guys, helped create. And the person said hello. And to my surprise, just the gratefulness that I called because they were so lonely and they were so thankful. And don't forget, they were quarantined as well, and other family members in the hospital. It just kind of broke my shield, and I felt like, just words enough was what they needed.
Well, and I remember you telling me about one particular young woman, like around 23 years old, and her whole family was here in the hospital.
Well, to this day, I still think about that phone call. So the one day, we get, the 24 hours later, I called a young woman, and turned out her brother passed away here. And I learned that she's young, and she was also in the hospital, and she was very, very sick. And
she had just gotten home.
And she just got home. But She was the only one that got home. The rest of her family was in the hospital. And, you know, as time went by, I journeyed with her from finding her brother's phone to helping her with a funeral home, to her next family passing away a few days later, to the following family member passing away a week later. And I helped her find all the belongings for each member, journey along with her until, you know, I always think about that because she was by herself. She lost her whole family in 2 weeks.
What were the things, Marion, that you found, you know, when you started those phone calls?
Yeah, I was like Val, you know, it was different, but I get the grateful. They were just, it was like we were their lifeline.
Mm-hmm.
And when I would get on the phone and talk to the families, they were frozen. They truly did not know what to do because it wasn't real. The death wasn't even real yet, because maybe if they came, it was through a window. They dropped their loved one off in an ED and never got to see them again. So they were so grateful for the connection. This is where their loved one took their last breath. And they wanted to thank that team, you know, and they would say things. What made it really doable for me was the families would say, thank that doctor, you know, for combing, really doctors were combing patients' hair and praying, nurses were praying with them. And we were able to then let the team members know. So it was like we were in between, just connecting them.
I know you also talked about the fact that you were really struck with the need for ritual.
Oh yeah.
That they weren't able to have any kind of funeral. Talk a little bit about why you think ritual is so necessary.
Yeah, rituals, funeral rituals especially, just really help you on that whole journey. Like kind of, you start like your grief going public. So you have a wake, families come over and bring casseroles. All of that, those rituals, normal things we take for granted, were not there.
And what do rituals do for you? Like why
so they really activate your support group, like your people come, right? They help you accept the reality, like it becomes real. And they help you honor that person, right? And to share the love and the experience and what their life was.
What kinds of rituals did you suggest that people?
So we had to adapt, and we did. A lot of the families, it was a two-way street, because now they were telling me rituals they were doing, and then we could share them with the next family member. But for instance, cooking their favorite meal and having a Zoom dinner. Sharing their music, creating music lists, a candle, which maybe wouldn't be something in some families they would do, almost like that shrine. But you know what? It was really important to do these things.
Yeah, and I know even at one point, you and I worked together on a flyer that we did, so that then when Val mailed things out, she could put the flyer that just gave as many ideas as we could possibly come up with. So whatever would work for that person, hopefully
something would click.
Yeah.
And just help them. You know, they were really resilient about not having, like the churches were closed, and I felt so angry about that. But I must say, they were like, no, this is the way it needs to be. And, you know, we're being safe. But it broke my heart.
Yeah.
It broke our hearts.
So your hearts were broken a little bit. You're doing all this work, but you kind of were in a little bit of a silo. I mean, talk about a little bit, things shifted again at the bioethics meeting.
Right. So I am a part of the bioethics team. So here I go on this virtual meeting, and they asked me to share what we were doing. And everyone had all these questions, and they really wanted me to share it then at our system-wide bioethics meeting. And I did. And Yvette Vieira then pulled together representatives like from each of our sister hospitals. We're part of a big healthcare system. And it was wonderful because like-minded people, you know, we got together to share best practices, and each place had different people who could do a little piece. We were very fortunate here that we have this Caregivers Center, and totally this became our full-time job. But even with that, other hospitals were all doing we were all struggling. How do we reach out and connect?
Well, and then you started with the system, but then I think it even went broader, right? And I was part of some of those big conversations with other hospitals.
And then it got bigger. So really that again, Vieira, got together with all the other big systems in New Jersey. There's only like 3, 4, right? And then we had these, weekly meetings where we could share best practices, then talk about our memorial and talk about support groups. And we had weekly Zoom groups. So really just everyone was really such a fast pace trying to figure out what to do.
Well, and I loved that you opened up your support groups to other hospital systems too. So you said, okay, I'm doing this day. And so everybody didn't have to reinvent the wheel, but they could all share.
Because look, the whole country was in crisis. This was a time to work together.
Yeah.
Yeah.
So one of the things though I remember is that everybody was struggling with this idea of how to put together a memorial service. And they were all doing virtual memorial services. And one thing that they were doing, everybody across the board, legal was saying, but if it's virtual, you can't use people's names. And you were like, not going to take no for an answer.
No, I made a promise early on. I realized I was promising these families about our annual November memorial. And as the weeks went by, I'm like, well, this isn't going to happen. We're not going to be in person, even in a park. So really working, together and just figuring out how can we do this. We need to say the name. Without a name, without that, even the picture, we're not really. It's not a memorial service that I think will really benefit the families and our team here.
So you really felt like saying the names was important. So then you went to marketing and legal.
We went to marketing and I came back with this form and I looked at it. I said, I don't understand this form. I have a master's. I wouldn't sign this if you sent it to my home. I don't understand what they want from me. So then it was just really just banging on doors and going in and meeting with our legal team here. And just everyone wanted to do the right thing. How can we do it? The families that were impacted did not have access to scanners and, they really didn't. And so we needed to have process to make it accessible.
Okay, so now we wanted their names and their pictures. We wanted to offer this to them and that put you, Val, at the center. So how did you get a hold of all of these people, hundreds of people?
Well, because originally when we had to call the list for 24 hours for bereavement follow-up, I made our own database. So the families that we spoke to, I put them on a separate spreadsheet and I had their names, their addresses, physical addresses, their email addresses, their contact phone numbers, little notes to remind me of who it was I spoke to. We told a lot of people. And with that database, I did an email merge, a regular mail merge, and I would send the legal, form we had made for the name to be said. Yeah, very simple. And we had an invitation. So if you want to be part of the virtual memorial, I would send it to you. And that's how we were able to send it out. So
and then you figured out a way, because how are we going to get these things back? So you were working with them, you were texting, they were taking pictures of pictures of pictures.
And the thing is that the responses we got, the people that wanted to be invited, they wanted their loved one to share with us. For us to honor them to be in the memorial was amazing. It was like the percentage was huge. So they sent emails. And so I had to give my phone number. I used my cell phone number because the person that used the scanner wasn't around. That knew how to download a picture wasn't around. So I would tell them here, you have a cell phone with a picture that you want, send me the picture to my cell phone. You don't have a scanner, send me a photo of that photo, like the photo release for the name, and take a picture and I'll just put it in an inbox. And so
I remember you went out to the front and somebody drove by and handed you something.
Everyone was just so wonderful. And I had to pick up outside the hospital. I would go out with like all this PPE gear to meet them. And then one time to our own mailroom in the hospital, we received an envelope of this lady who just wrote Overlook Medical Center, no address, no return address, no stamp. And it just put like care, so somehow it got into our Caregivers Center inbox. And I opened it and it was a woman I spoke to on the phone, the picture of her mother. And so I said, this came through angel's wings. And I showed Mary, I'm like, how did this come to the hospital? It looked like it was torn, ripped apart, it went through so many
carriers. And it was the original picture.
And it was the original picture. So I called her and I said, I got your mom's picture, thank you. She was so happy. And I was just baffled, how did we get this? It was just,
It was crazy.
Yeah.
Like you said, all these projects were sort of like through Angel's wings and just
Yeah.
figuring it out.
Yeah.
And reaching out to people that you could find. One of the things that I remember when we talked about the memorial service too, it's that we wanted to honor the family, but we also felt it was very important that we honor the team staff members here. We had a beautiful Schwartz turnarounds after that first surge where people really shared their grief, shared their pain. And we all looked at each other and said, okay, we've got to figure out a way to really make them part of this memorial service. We didn't want it to have a fixed church service that they felt like they were watching. Instead, we wanted to come up with a way to invite as many of the staff members as humanly possible. People from engineering, people from the floors, people from environmental, like everybody we could, administration, we wanted to put them in somehow. And one of the ways we did that actually was we actually made a day in the auditorium where they could come in and light a candle. Can you tell us about that?
Yeah, that was beautiful. And I think our intent was, to have this service, but we weren't all allowed to be in there. So we, just like our regular annual service, we had a beautiful altar. Our music therapist created music. On the big screen, we had really beautiful pictures of nature. And we opened it from 6 a.m. to 8 p.m. And the bereavement group, again, we all had time slots just to give them an opportunity to come in.
They could come in and they could light a candle and put it there. And they were electric candles.
Electric. So many people came, it was just beautiful. And we thought we would film, but then we found it was pretty emotional for staff. So we would have them do it, and then we would maybe ask them on the way out, could we just film you now doing this? Because it was like an intrusion. This was really healing, really healing. I know it was for me and for us.
Well, and I also know one of the other things we did is we had staff who had lost family members. And staff members who passed away during this time. And so we also made sure part of the service had a moment where a candle was actually physically lit. And again, we had to go through a lot of bureaucracy to make sure they could actually light a candle and they were able to say a few words. And
I think that was important. Again, getting back to ritual, but how symbolic the candle and battery operated, they worked, but I wanted the next step. So again, had to go to security, but again, they all wanted to do the right thing. And they said yes, and they were out there with their fire extinguisher ready to go.
So let's take a minute and let's show the next clip, which is a piece of the candle lighting. We cut out when people were talking and just to give you a flavor of what that candle lighting day was like. some of those more beautiful shots were done by Will Green, our media guy that really stepped up and helped us throughout the whole thing. We also had a professional editor who offered some of his time at a very low cost that helped us put the footage together. But I also have to say a lot of the footage for the actual memorial service, we did on iPhones.
Yeah.
So again, we just sort of said, I don't know how we're going to do it, but we'll figure it out. We've got phones, we'll make it happen.
Yeah.
You can see from the pieces that we showed you earlier, we also wanted to make sure that various languages were used.
Yes.
We had as many people as possible.
We wanted
In the
to really
rising of the sun and it share.
we really wanted it to reflect the people that were impacted. And we knew, because we made the phone calls, the populations, and it was definitely a lot of immigrant populations, definitely not English speaking, a lot. And so I think they were really, we chose those languages really
Specifically on the people.
specific on the families that we had called.
And then we had the staff members who spoke those languages.
Yes, because we definitely are represented. Right?
Yeah.
That's our community.
Well, and I also love the fact that you talked earlier about bridging, how your center bridged between the two worlds. Val, if you don't mind telling us about what people said when they called up afterwards.
Oh my gosh. They were just, I can't even say the word, because the feelings that they exuded over the phone, the text they sent to my cell phone after they sent me the picture, they thought we were like their best friends.
Well, the other thing that I remember you telling me was that it was, they saw the faces for the first time.
Oh my gosh,
So these
yes.
phone, people they had heard over the phone, and all of a sudden it was a face, it was a real person to them.
Yeah, they would see the name of the intensivist or, or the nurse, and they're just like, oh, that's what they look like. And they just felt like they were just so grateful for the care and the love they showed their family member, that they just were so happy to see their faces, or they even recognized voices watching it. Because just think, everything was by phone. They never met anybody. So it's amazing how the sense of hearing really was in tune.
Yeah. So the other thing that I thought was interesting is that our goal was really to not just help healing for the family members, but also for the staff. Yeah. And we set up this time in the auditorium for the staff to come and the team could come and watch the video, and nobody showed. So we administration showed, to be polite. But we were like, oh, I guess nobody really cares about this. It's fine.
Yeah.
And then we walked into the hallways where everybody was crying.
And they came up to us. They had watched it in private on their unit. That's their support, right? And because they were all part of the filming, we included so many, and they got to see those pictures, and they remember those people they cared for, right? Yeah. So it was beautiful. I think it was very healing.
So we came to that place, we had the memorial service, and we thought, oh, we're done with COVID, and of course, that's not what happened.
No.
So again, you had to shift and regroup, and what are the things you did moving forward when the next surge came and you had a memorial service?
So we actually had to do another virtual memorial.
And we promised we would never, ever do another video. We said we will never do this.
We'll go to a park, but then again, in November, you couldn't. So we did another one, and that was our annual one, and we include much hospice, oncology, and of course palliative care. And we used a different theme, but again, we really incorporated staff and hospice team.
So has this program continued? I mean, you did it for all these COVID patients, but I think you've kind of continued it for everybody, right?
We're still doing it.
We're still doing it.
Still doing it.
We still call every family.
Even if they're not COVID, anybody who's passed
of course.
away.
Yeah. And the calls have changed. I mean, during COVID, we would be on the phone making sure they had food, helping them get test results for their own COVID. Really just bearing witness to their story. And now they're different, but still, really helpful.
Well, and I just want to bring up Val again. You guys do a lot of the calls together, but you're doing a lot of these mailings. You got a 1 month mailing, a 3 month mailing, a 1 year mailing. How is this? Is this doable for people who are watching? They're like, that's great. You got a caregiver center. Like, there's no way I could do this. but I don't know, I think you found that it's.
It is doable. I would say the challenge at first was that we had so many people and I didn't begin to do those letters. Thanks Sharon for sharing me the letters. Sharon and the palliative team had already letters in place. So she would just show me, what to do, what she sends. And then with our Overlook Foundation, we were able to get booklets of grief, pamphlets we sent to the families. But it's so doable. I mean, in the database, you just put the date of, when you sent it, and then you put 1 month, 3 months, 6 months, 1 year, and just check it. In the beginning, it was just a lot because there were so many. But now it's just, you just go through the list. Okay, today's this date, a month ago, okay, and then you just do it from there, and it's so doable. And you know what? It's so worth it because families really do need it. The community needs it. And it's so, you just feel so, it's a feel good for yourself. It's just,
and they call, right?
Yeah,
they call,
exactly.
Especially after just recently we had the first anniversary ones.
Because I sat out the year and we got calls like of them crying, saying, thank you for not forgetting us. You didn't forget us. Or today's the anniversary and I received this in the mail today. And they just love that we still remember them.
And we really handpicked the brochures, a lot from the Center for Loss in Colorado. And our foundation did fund that. And ones if you lost a sibling. And so really, and our bereavement for the children, we are really blessed here with Good Grief and Imagine. I can't tell you how many families we've connected for those grief support. A lot of children were impacted. Yeah, many children.
Amazing. But the other piece is that, Marion, I know that you're not done. You're always recreating. There's always something more. And just a couple of weeks ago, we had another bereavement consortium meeting, and you were talking about the next place that you see a need.
Yeah.
Can you talk about not what you've done, but what you're thinking of doing?
I know. I feel like we've done so much, but we're not done. The community, our nation really is still grieving so many different losses, but so many lives lost. And I don't think we can ever forget that. And I don't know, and I think we're doing a great job and sending out this information, but I think we can be doing more. Now, we offer support groups here at Overlook, and we refer out in our bereavement group. We have a whole bereavement resource guide that we've developed over the years, so we can really connect people. But I don't think the communities and the families that were impacted a lot by COVID are the ones coming to our 6 weeks.
So really what you talked about is some of the immigrant communities,
yes,
some where English is not their first language, that those are the people you kind of feel like you're missing.
And people of color. I just don't think that's not who we have found here who's attending our support groups.
So what are you thinking about doing?
Well, I think we need to reach out to those communities and find out. And one of our chaplains had a wonderful idea at our last bereavement group. She is, an immigrant, and she said, let's reach out to our own team members, because we do reflect, right, our community, and just do like focus groups and see what can we do as this bereavement group. What can we do? Is it going out to the churches and maybe, I don't know. I don't have the answers, but I want to find them.
Yeah. Well, and that's what I think has been amazing as you've talked about this whole journey you've been on, is that you always seem to start with listening. Instead of going in and deciding what to do, you resource, you listen to the people who are affected, and you kind of let them guide you in what you're going to do next.
Because they're the experts, right? No one else knows anyone's grief but themselves. We know what the literature says. We know the best practices, but I think now we're kind of at a crossroads, and there's work to be done. Yeah.
So, okay, after all this, what's your big takeaway?
I think so many things, but I think for me, going through this process of the memorial and really kind of pushing the envelope, just not to give up. I made that commitment. We were going to have a memorial and say those names. And it was done. And even now, not to give up. That I know there's people out there suffering. I don't have the answers, but I'm not going to give up. And I want to brainstorm with other people and groups and figure out how we can reach out and support people in their loss. Yeah.
Val, what's your big takeaway?
Well, there's a lot of work to be done to continue to do. But one thing I've learned from this, as scary as it was, and to make the phone calls and to do this, and as heavy as it was, and starting all this in a time of crisis, just a pandemic, and it was so different. But at the end, it made me grow, and it was needed. The community needs it, and it's very important. And it's easy to think they have support elsewhere, but just that extra support coming from, the hospital, whoever, it's so appreciated, and it's a blessing. It's a blessing for them, and it's a blessing for us, and overall, it was a good thing to do.
That's wonderful. Yeah. That's wonderful. So to kind of wrap this up a little bit, we're going to show you one more clip from the video, and this is an example of the way we took an existing prayer that's used at a lot of funeral services, and we kind of reimagined it in our own way.
That's the beginning.
That's it, but
That's it, but not the beginning. And this is where we really went around the hospital.
This is with our iPhones, yeah.
In the rising of the sun and its going down,
we remember them. In the blowing of the wind and in the chill of winter,
we remember them. In the opening of buds and in the warmth of summer, we remember them.
When we are weary and in need of strength,
we remember them. When we are lost and sick of heart, we remember them.
When we have joys we yearn to share,
we remember them. So as long as we live, they too shall live, for now they are a part of us.
As we remember them.
As we remember them.
As we remember them.
As we remember them.
As we remember them. As we remember them.
As we remember them.
So now we'd like to hear a little bit from you guys, if anybody has any questions, or also maybe if you'd like to share some of your own experiences of COVID, or a stumbling block that you've got right now. If there's something you're trying to move forward, if there's a way we can help brainstorm something you'd like to do.
Thank you all so much for sharing. We do have some questions that have come in, and Randy asks, how did you feel and manage your own experience of being so immersed in this unfathomable grief?
Good question. It was like, thanks for asking that. Yeah, it was really like Val and I were in a cocoon. I felt very safe here in my office. But how did I manage? A lot of Krispy Kremes, which was not good. So they were giving away those free donuts and oh God, it was awful. And so that wasn't a healthy way, but I do a lot of Tai Chi and Qigong. And I actually had signed up for this program, and that was my self-care. And I had a grandson in the height of the pandemic, which was a double-sided thing, because at times I wasn't allowed to see him because of COVID, but yet there was joy and the support with Val, Sharon, with that team. And I have to tell you, our lobby team here, and our gift shop. So that's we couldn't go to the units, but we supported each other here. And laughter, yeah, and crying, definitely some tears. Yeah.
Yeah, and I think you talked about it a little bit. It was also reaching out to the other system-wide hospitals and going, oh, okay, I'm doing the right thing. Part of that was sharing resources, but some of it was also affirmation for you that it's okay.
And to know it, we couldn't fix this, and some of it, but just really, I felt it was an honor to bear all this witness, but it was heavy. And I must say, in preparing this for Valerie and I, and I'll speak just a little for her, when we started to prepare for this, it was tough going back.
Yes, to prepare for this presentation. It's funny, we've done a couple of run-throughs, and some tears come out, and we kind of just honor that and let it be.
What I did is that the running joke in here, I tell everybody in the hospital, is that if I had to be stuck with one person in a room for during a lockdown all day, it would be Marion, because we actually did not. You know, you did with someone for so long, you just want to like wring each other's necks. It had like the opposite. It was like we were so supportive of each other, and we were there for each other. We could talk about the phone calls and how we felt, and with outside life too. And one thing I did do was I would take a walk during the day when I was working, and I would take just a walk just to clear my head between phone calls, because that was very important. So I would like to get grounded with nature. On my days off, I would go running in the park, and I always made sure to just do some form of exercise.
She only got lost once.
I only got lost once.
She actually got lost. I mean, this is how like distracted you were, but she took a long walk
to a different town
and was following the sirens back to the hospital.
To the
but I
wrong
don't think
way.
they were coming here. So yeah.
I was 3 miles away from the hospital. So I had to run with my work clothes on, like a crazy person in a lockdown down the street with a mask on. So yes, that was another funny story.
Thank you.
Thank you. Someone asked, what is the name of the consortium for listeners to access?
You know what? We just made up this name. We call ourselves the Bereavement Consortium. Completely made up.
It was a hospice social worker. She loved the word consortium. So we're like, okay.
Okay, we'll call it that, you know, and so it's like our own made up name for our own little creation. But again, I have to say, if I can't recommend anything more, it's just to say, if you reach out to the people, there are people within your systems that are interested in this that can't do everything. So you do something small together, and then more can happen. And so you're not overly burdened.
That's a great idea. And kind of related to that, someone asked, how are you preparing your staff for possible future pandemics? And now that you have this experience of what worked well, what didn't work, if you have any thoughts about that.
So I would say one of the things I would like to share actually is once we had the second surge, everybody was really terrified of it, and it came. And what was interesting is people, they were sort of putting up more of a shell, right? Feeling more hardened at that point. And the community, people were not clapping, you know, people were not bringing food, you know, it was like, here we go again. And everybody wanted to move on that was outside the hospital. So we actually did a program again. And we did some things like we found some little rocks that had some nice inspirational sayings, and we brought those around. We had chocolates. And what we did is we kind of did a different thing per week. I have some little cards that have, again, little pop open cards with inspirational sayings. So if I was on the floor and somebody was having a hard day, I just had them in my pocket, pull it out and say, you matter, and could do that. So we were trying to be very proactive because we knew they needed support and they didn't necessarily think they did. So it's sort of trying to sneaking it in for them without them coming in.
Because as a system, we have so much caring for the caregiver that we have a lot of wonderful programs. But I think what we've learned during COVID is we relied on each other. On those units, they rely on each other. So I know our Dr. Bolo went around and was really doing meetings on the units with the staff.
Yes.
And so our bereavement group, you know, we were making these baskets. And again, we had some funding because the community was so generous that we, you know, again, snacks and things, but we were visiting the units and just trying to engage a bit, you know, and to show them we're here because part of our bereavement mission is to support our team members in grief too. We're all, you know, grieving.
That's, I love that idea because I think many of us don't, like you said, don't think we need the extra support or we just don't want to ask for it. So being more proactive is great. And I liked how you touched on rituals and how important that is in the grieving process and how, I mean, during COVID, a lot of those rituals were just taken from us and there wasn't a way to do them as we normally would. And many different cultures have different types of rituals. And so I wanted to ask, what are some of the rituals? You shared some that you did through the memorial service, but some of the rituals that you were able to do or help with families that you see being part of the future, in future years, how we might incorporate those.
Well, and some of the things were things that we pulled from practices. I know in palliative care, I often have families at end of life, and they're sitting there, they don't know what to do. So one of my favorite things is to tell them to make a personal playlist for the person that they're sitting with, and tell them about the research that there is about how, you know, music from your life can really give you such a sense of peace and calm and joy. And so I really feel like when I tell family members to do that, it's not necessarily for the patient, but it's really for them. And they're able to go, oh, didn't he like this song? And he loves this song. And they can make the playlist together. So we were able to take some of those practices and say, you know what if you make a playlist and everybody in the family adds on to it? And things like that. The meal idea that somebody told you, or there was one that they all took a shot of like his favorite whiskey.
So a lot of toast, virtual toast, and then sharing. You know, there were a lot of virtual funerals and things as well. But many people, a lot of our families opted not to have anything at that time. And they were talking in the future, we'll do it in the future. And that worried me. That worried me because I wonder how many people, you know, even like for us, kind of rehashing and digging all this up again, you know, they kind of let that go. So we were really encouraging them that, you know, you can have a million rituals. You can do a ritual 5 years from now. Like there's no timeline,
right?
You know, and little ones can be very meaningful, planting a tree. So, you know, things like that, connecting, you know, with nature. And I must say the candles, which isn't something I would really ever do in my home. And I know like in a lot of Spanish homes, I would go in, right? And you would see all that. But I think that was really helpful for a lot of our families. And you know how you get the pictures ready for a funeral home? Well, instead do it and have it in your home and share it.
Yeah, and I think that was the key, again, because people say, well, I'm gonna have the funeral later, right? So we never said, do this instead of a funeral. No. We said, these are things you could do right now. Or you could do next week. And so we even, I think in our flyer, we even say, and set a time now for a check-in with people in a month or, you know, in a certain period of time that you're gonna check in with everybody. So just to see how everybody's doing. And maybe do the ritual again or not.
Yeah. Never too late for rituals, you know, and they really serve that purpose. And we just really encouraged them to reach out. And some people, they lost so many family members. It impacted like families, like Val's example. Unfortunately, she was very young, but we had multiple families and they were in multiple hospitals near us. So.
That's it. I really like that. Carrying out rituals just doesn't have to be done in a certain amount of time, just because, as we know, grieving is not going to happen a certain amount of time either. So thank you for that. Well, we just have a couple minutes left, but if there's anything else you all would like to add, I really appreciate your time today.
We were wondering if people want to see the video. One of the issues with our legal department was that they said, because we had the names and the pictures, that it could be open to the public, but they wanted it to be an unsearchable video. So if anybody wants to go to it to look at some of the ways.
It's in the chat.
Oh, it's in the chat. And yeah, you can look at the chat and see that. Thank you. But that's the way that you can see it and come up with some ideas potentially on how to do things a little bit differently.
Thank you so much. And just thank you for sharing, and thank you so much for all that you've done with the community. And thank you to our audience here today as well. You can keep an eye out for the recap of this week's sessions and an email that will contain a link to the CMEs and CEU post-test for today's session. And we'd also like to thank our national business members for their year-round support of the Schwartz Center. We would not be able to do this conference without them. And we look forward to having you all back for compassionate healthcare education, capitalizing on character, strengths, and mattering, an interactive workshop tomorrow. So thank you all so much, and I hope you have a great day.
Thank you. Bye.
Thank you.